Good morning. I'm Dr. Bob Underwood. I'm the Chief Medical Officer here at San Juan Regional Medical Center. I wanted to take the time to do a weekly update like we tend to do here at San Juan Regional, especially in light of the COVID infection that we've been seeing. I want to start out by talking about some things that are going on in our community above and beyond even the COVID infection right now. And that has to do with the George Floyd incident and some of the protests that are going on around the country and even in our community. To think about how that affects our community and how it affects our organization, I think we really need to go back to our values as an organization. First off, we talk about personal reverence. In personal reverence, we say that we will look for and honor the differences in each person. And then the other component is sacred trust, and that is we will do the right thing for the patient no matter what. And those two are mutually intertwined right now, especially in light of what we're looking at. And I know that people are filled with different emotions, sometimes confusion, sometimes anger, sometimes frustration, and trying to understand what's going on. But if you take a baseline look and look at it through a system of curiosity, empathy, and compassion, I think that it gives us the right position to try to really understand others and what's happening in our world. All right, so what are some of the other things that are going? Of course, our infection around COVID-19 and how it affects our organization is still foremost in a lot of the operations at our organization right now. So I'll be talking a little bit about that. Let me start by saying that there's lots of guidelines that are available from the Department of Health, available from the CDC. And yes, data changes quickly because it's so new and we're learning so much so fast. And so please try not to be frustrated with the changes of information. But right now, the best policies are to wear a mask. I wear a mask to protect you. You wear a mask to protect others around you and to protect me. And always try to keep that in mind. Why do we wear the mask? It's really to protect other people more than it is to protect ourselves. We don't do it out of a sense of fear. We do it out of a sense of responsibility for other people. All right, so I'll get on to the updates as we have at our organization right now. San Juan Regional Medical Center, a COVID screening line. If you feel that you need to be evaluated, now we have a screening line that anybody can call. And that number is 505-675-4722. Additionally, the New Mexico Department of Health has a COVID-19 screening line as well. And that is 800-600-3453. So if you keep those numbers in mind, and you can call and get set up to have a screening done. Now, with all of that in mind, our emergency department is still open for all patients, regardless of what the complaint is. So please feel free, if you need to come into the emergency department to be seen. Or if you have family members that need to be seen, do that as well. But if you do come in with COVID-like symptoms, cough, fever, sore throat, shortness of breath, please call ahead. This gives us the ability to prepare for your arrival in our emergency department and to protect other patients and to protect our staff should you have a COVID-19 infection. When we say call ahead, the number for the emergency department to call ahead to, of course, is the 505 area code, 609-2901. So let us know you're coming so we can do the appropriate level of preparation. Now, I kind of started our discussion talking about the stress that a lot of people are under right now. And so there's some support lines that have been developed for mental health or resiliency type things. And if you need to call those lines, please do. As Jeff said last week, it's okay to not feel okay, but it's not okay to let somebody know. So Statewide Mental Health Support Line is available, and that number is 855-466-7100. Then there's also a statewide healthcare worker and first responder support line. And again, our caregivers are under a certain level of stress right now. a lot of it around the unknown and a lot of it around long hours and working under unusual conditions. The support line for the statewide healthcare workers and first responders is 855-507-5509. Now, as many of you know, we have been doing what we call our external assessment area, which was also the COVID testing tents or the drive-through area. The demand and the number of patients coming through that area significantly decreased. And so we are no longer operating that here at San Juan Regional Medical Center. However, the Department of Health is doing drive-up COVID testing in a number of places here in town. So on Monday, June the 8th, at Judy Nelson School in Kirtland, they will be doing drive-up events starting at 7 a.m. On Tuesday, that will happen at San Juan College. On Wednesday, June 10th, it will be back at Judy Nelson School in Kirtland. And then again on Thursday, June the 11th, at San Juan College. No appointment is necessary. Bring your cell phone for registration. Again, there's no cost associated with this either. So those are the locations where that will be happening. San Juan Regional Medical Center services. Of course, like I said at the beginning, our emergency department is open 24/7, 365. We're always available, but please call that number ahead if you have symptoms that are consistent with COVID-19. Also, I want to point out that we've begun to reopen our elective services here at the hospital. There were a lot of procedures based on state guidelines and even state orders that we had to suspend for a period of time. Those are starting to reopen in earnest now. Certain types of procedures, surgeries, etc. So we encourage you to contact your primary care physician, contact your providers, and see about getting those scheduled if you had those kind of ready to go or were looking at those possibilities prior to COVID infection being so prevalent. So contact your providers if that is something that is a medical need that you have, and start to reestablish our relationships with our primary care providers as well. A lot of those came to a stop. There were vaccinations that were missed for pediatric patients, for example. And so we're really trying to get back into the normal swing of things and how we do our primary care and regular care with our primary care physicians. So here's some other updates. I'm very happy to report that the northwestern section of the state of New Mexico, which had one of the worst rates of expansion of the disease in the state, is now actually one of the better, quote, performing areas of the state. We look at something that's called R-effective, which is the replication of the virus in terms of if one person gets it, how many other people does that spread to? The goal, or one of the benchmarks for the state, was to get that number down below 1.15. And that means that every person who gets infected will spread it to 1.15 other people. We are now at 1.08 in the northwest corner of the state, and that's better performance in most of the rest of the state. So that's really, really encouraging. Now, anybody can do the math really quick. We'll figure out if one person is spreading it to more than one person, anything greater than one, then it's still a growing disease, and that is the case. But we're doing much better here in the northwest part of the states than some of the others. So what does that really mean? Keep wearing your mask, keep washing your hands, keep doing the social distancing that we've been talking about. Nonetheless, as businesses start to open up in our community, try to patronize those, maintaining all of the appropriate precautions. Our businesses have been especially hard hit here in the northwest part of the state, and it's important that we support our local economy while still doing all of the things that we need to do to prevent and reduce the spread of the disease. That may seem counter to one another, but it's not. We can do both, and we can do it effectively as a community. All right, the New Mexico Department of Health also reports out our overall percentage of testing in terms of how many are positive. And we, again, in the northwest part of the state, here in the Four Corners area, have had an especially high percentage. Right now, based on the information that we're getting from the Department of Health in New Mexico, our number is down. We were up over 15% of the tests that we were doing were coming back positive. That number is trickling down. We are now somewhere in the 12% range, 12.5% range. So it's still high, much higher than the rest of the state, but it is going in the right direction, showing a decrease in the prevalence of the disease within our community. The other rate that they really look at, and we follow along very closely, is hospitalization rate of COVID-19 patients per 100,000 of the population in that area. This is a regional look, so this includes McKinley, Cibola, as well as San Juan counties. But the New Mexico rate as a state is 58 patients per 100,000 population. Now this number really sounds kind of astronomical because in the northwest corner of the state, there are 368.4 hospitalized patients per 100,000 population. That is way higher, and it also speaks to the burden that is placed on our community in this region of the state, and especially on the Navajo Nation. All right, here's some other statistics that are not regional, but really down to our hospital itself. Today, as of June 5th, 2020, our hospital census, and that's total number of patients in our hospital right now, are 117. That's actually low for this time of year. But that, remember, has to do some with decreasing other services that we had been offering prior to the COVID infection. We're starting to build those up, as I said again. All right, COVID confirmed cases in our hospital right now are 25. That means they've had a test and that test has come back positive. Patients that we're still waiting for tests to come back positive, or we don't have a positive test on them, which we call a PUI, patient under investigation, we have 6. So that leaves us with a total of 31 COVID positive or COVID treated patients in our facility right now. We have 8 intubated patients in our hospital. That is patients who are currently on a ventilator, and of those, 7 of those patients are COVID positive or PUI that I mentioned just a second ago. That means we have 1 patient who is not considered a COVID patient who is on a ventilator in our facility right now. Total number of COVID cases that we have taken care of in the hospital, this goes back to mid-March. That was the first case that we had. So the total number of inpatients that we have had at our facility for COVID are 295. We have discharged from that 295, 217 of those patients. And we have had 53 patients that have died or passed away secondary to the COVID infection. Still in-house, as I said, we have 25 patients that are confirmed. And so the numbers are starting to decrease. The numbers in our community have been decreasing for some time, but the hospitalizations lag behind that because those are the sicker patients, and often they're not even admitted to the hospital until after they've been sick for a little while. But those numbers are starting to go down. So we are encouraged with that data trend at our facility. However, we know that this is going to be around for a very long time. It won't be until we have a vaccine, until we have treatment that is very definitive, and we've been doing lots of things. We've treated patients with remdesivir. We have taken on quite the number of treatments that you have been hearing about in the news, and some of them have been promising, and some of them not so much. Again, we are learning so much about this disease, and we are learning it so quickly. But we know it's not going to be gone, and so we are learning how to resume our operations as a facility in line with treating COVID patients, not after, because we know that it's going to continue. So with that, I want to say we are learning, we're moving forward, and we will continue that path. In closing, I'd like to say thank you to the medical staff of this hospital, physicians, nurses, respiratory therapists, physical therapists, housekeepers, food services. Everybody has pulled together as a team at this hospital to adapt to the current circumstances, continue to care for our patients, and really to care for each other in this overall process. It has been heartwarming to be a part of this team, and I cannot express my appreciation enough. So thank you, and to each of you, God bless. Have a good weekend, and stay healthy out there.